Thank you for coming along to this month's Lunch and Learn from Community Care Chemist. It's Medication Management Month this month. So we're talking e-scripts and the MedAdvisor app, which are great ways to help manage your medicines. And with e-scripts, you can go paper-free and save the environment a little bit. So we'll go over e-scripts. MySL or Active Script List, which is a centralised repository of your e-scripts that you can access from any pharmacy, and the MedAdvisor app as well. And if you have any questions at any point, feel free to barge in.
No, you have to assume that we're totally ignorant.
Have you had any e-scripts yet?
I've had a couple.
Yeah. And you didn't know what to do with them?
Well, the doctor sent them direct.
Oh, to the pharmacy. Yeah, okay. Well, this is what you'll be familiar with, which is the paper prescription, which has been the one and only way to get a medicine for decades. And in the last couple of years, e-scripts have come along as an alternative. So they don't replace paper prescriptions. They both live side by side as valid and legal prescriptions. But if your doctor has issued a prescription, it's one or the other. So it's either a paper prescription or they've done it as an e-prescription. So with a paper prescription, there's only that one copy. Once the doctor hands it over to you, that's your script. If you lose it, if you spill coffee on it, that's it, too bad, your script's gone. Whereas with an e-script, it lives in the cloud. So when your doctor issues the prescription, they just send you a link, which is called a token, and that's your access to the prescription, but the script itself lives up in the cloud. If you lose the link, we can always try and re-find it. You can share it with someone else, so if you need to send it to a family member to come and pick it up for you, or if you want to send it straight through to the pharmacy, you can forward them on that link, and then they can access the script on your behalf. The other great thing with e-scripts is that they are portable. So if you're if you're interstate and you've left your scripts at heart behind, or you've left your medicine behind, your doctor can issue you an e-script to your phone, and you don't have to worry about it being sent in the post or being faxed or anything like that. It's a valid script ready to go. Welcome along.
What about if you've already got an e-script, Bryce, and you do go interstate?
Yes.
Can you just bring it up on your phone?
That's right, yeah. Okay. Yep. So we'll talk later on about the app, MedAdvisor, and My Script List, which are two different ways that you can access e-scripts that you've say already had dispensed. So, like I said, your e-script lives up there in the cloud. So once your doctor writes that prescription, it goes up into the cloud, and then there's a few different ways that we can access it. So with a token, which is essentially a link to that prescription in the cloud, your doctor might send it to you as an SMS, or they might email it to you. They do also have the option to print it out, which is what you'll see with a QR code just on a plain piece of paper. But it's an e-script, so it doesn't really make sense to print it out. So normally they'll either send it to you as an SMS or an email. Depending on your doctor and what the script's for, they can issue that token to someone else. So they could send it through to your preferred pharmacy directly, or to someone else on your behalf so that they can manage the prescription.
How long do they stay up in the cloud and are available?
So a prescription is valid for 12 months, and it will live in the cloud as long as it's a valid prescription until it's dispensed. So the other way to access an e-script is through your Active Scripts List. This is a centralised repository of all of the e-scripts that have been issued to you from any doctor. You do need to register for an Active Script List once, which I'll run through in a little bit. But then once you've got an Active Script List, you can walk into any pharmacy and you just need to provide them a few details and they can access your e-prescriptions on your behalf. So you don't even need to have access to the token. You just need your name and your Medicare number and a few other bits and pieces, and the pharmacy will be able to access those scripts for you. It is really good, yeah. And it means if you've got a script that your doctor sent you a month ago, you don't need to scroll through your emails or scroll through your messages to find it. Exactly. You leave your phone at home. It's a really easy way to be able to access your scripts. And like I said, you only need to register for it once, and then you provide consent to pharmacies on a pharmacy by pharmacy basis, and we'll run through that in a bit. So that's what a token looks like. So when you get a link sent to you as an SMS or an email, clicking on that link will open up this page, and it has the QR code, which is what you would show to a pharmacy to get that script filled, and a few details about the prescription. You'll note here that it doesn't show your name. So this prescription can be accessed if you share it to a family member or someone on your behalf, but it doesn't specifically tell you that it's for you. That's just a privacy feature. To access the full details of the prescription, you need to have a secure connection to the eScripts cloud, which is possible through pharmacies only. So as I mentioned, the other way to access your eScripts is through this active script list. Active script list is like a generic term for the functionality. At the moment in Australia, there's only one active script list which is marketed as MySL or MyScriptList. At the moment, those two terms are essentially interchangeable. And so like I said, this maintains a list of all of your active e-prescriptions in the cloud. At the moment, to access a MyScriptList or your active script list, you do need to visit a pharmacy. But hopefully in the not too distant future, there will be some apps that are developed that allow you to have a look and manage your MySL yourself and see all of those scripts.
What if your script's multi and you only want one?
Yeah,
Two?
yeah, as in if there's repeats on the prescription.
No.
Oh,
Individual.
yes.
Variation.
Yeah, so with a paper prescription, a doctor can write 3 items on a paper prescription at a time. With an e-script, one e-script is one medicine. So if your doctor was prescribing for you multiple medicines, you would get multiple e-scripts. So you'll get multiple, if they've sent it to you as a token, as an SMS, then you'll get multiple SMSs for each of the medicines that they've prescribed.
Are doctors trained in this as well?
They are, yes. Yep. Some doctors are more keyed into it than others. So it depends on your doctor.
Some of the surgeons, it would be way over there.
Well, that's right. We still get handwritten scripts from some of the surgeons, so it does depend on the doctor. The GPs that are writing, hundreds of scripts a day, for them, it's fantastic because they don't need to get their pen out to sign the prescription either, and it saves paper. The other benefit of eScripts from the doctor's perspective is that they can actually cancel it as well or modify it. So once they've issued their prescription, if they go, oh, actually, I meant to prescribe this, or I wrote the directions wrong, or it was the wrong strength, they can cancel it even after they've issued it to you, and then the script is recalled and you won't be able to get it filled. Whereas once they've handed you a paper prescription, that's a valid script. So doctors like that feature as well, which incentivizes them to move towards eScripts. So eScripts, actually we'll run through MySL first. So the consent flow for active script list is just that you need to register once at any pharmacy. And to do that, your pharmacy will just get some details from you and they'll send you a text message asking if you'd like to register. And then you just need to reply with the number 1. And then you get a second text message asking if you'd like any current eScripts that you have to be loaded into your active script list. And you just reply number 1 to that. And that's it. Your MySL active script list is ready to go. So you could get that registered at your regular local pharmacy. But then if you are traveling interstate and you've left your scripts at home, maybe intentionally because you know you have an active script list, you can just visit any pharmacy, mention that you've got an active script list, and then they will just do the same thing, asking for consent to access your script list. So by default, they can't access it. The registration flow will just send you another text message saying, do you consent to Brisbane Pharmacy accessing your script list? And you can actually choose for it to only be for 1 day. So that they can access your script today, but then once you come home tomorrow, they lose access to it, just as a bit of a privacy feature as well. Yeah, it's really good. So the other way that you can keep a track of your prescriptions is with an app called MedAdvisor. So MedAdvisor is an Australian developed app that helps you keep track of your scripts. And it is available in the App Store for iPhones and Androids. And it links in with your local pharmacy to help you keep track of your prescriptions. It works with paper scripts that you might leave at the pharmacy, and it will also work with e-scripts that you get sent through from your doctor as well. Registering for MedAdvisor is really easy. So you just download the app from the App Store, choose your local pharmacy. They just need to confirm a few identity details to make sure that it's paired up with the right person in the pharmacy system. And then you're ready to go. You can use the app to order prescriptions, to remind you when it's the last repeat, to remind you to take your medicines. It's a really useful app. It also provides information about the medicines that you've been prescribed and dispensed as well, if you're at home and you've got any questions. The other way to access MedAdvisor is just to ask your pharmacy. They can get you set up with it with an activation code too. So there is just a little video that I'll play that runs through the features of the MedAdvisor app.
Whether you take multiple medications or just one, MedAdvisor is a free app that helps you stay in control of your health. No more waiting in line at the pharmacy. Now you can order and pay for your medications through the app and choose to have them delivered or click and collect from the pharmacy. Plus, you can add regular pharmacy items like vitamins and NDSS products to your order. Use your phone as a digital wallet to securely store your e-scripts or photograph your paper scripts. MedAdvisor remembers so that you don't have to. The app gives you full visibility of your medications, including the number of repeats left and days supply left. Plus, it prompts you to take your medication and reminds you when you're running low or if you need a new prescription. With Carer Mode, you can add family members to your account and manage their medications with ease. Conveniently book a service, including COVID-19 and flu vaccinations, with your favourite pharmacy. Get started today by downloading the app, choosing your favourite pharmacy and creating your account. It's so simple. MedAdvisor is trusted by over 2 million Australians and recommended by pharmacists nationwide. For more information, visit www.mymedadvisor.com today. Your health in your hands.
Bryce, that said something like, you can photograph your existing paper scripts.
Yes.
And then they go into this cloud.
They don't, unfortunately. It doesn't turn it into an e-script. What you can do, though, if your doctor has written a paper prescription for you, is you can take a photo of it with the app and send it through to the pharmacy, and we can get it ready for you. You do then need to bring in that paper prescription when you come to collect the medicine. You're welcome to have a seat if you'd like. Okay. So I'll just run through what it looks like to add an e-prescription to the MedAdvisor app, which is a really simple flow as well. So your doctor sends you an e-script. It comes through as a text message, which is a link that you tap on. If you've got the MedAdvisor app installed on your phone, when you tap on the link, it'll actually open up the MedAdvisor app and it'll give you the details of the prescription as well. And then you just click this Add to App button and it's loaded in with all of your other prescriptions. It's as easy as that. From there, the main MedAdvisor screen, you can then view the details of the prescription, see how many repeats you've got left, and you can send it through to the pharmacy to get the medicine ordered, and we can have it filled and ready for you to come in and collect, or you can opt to have it delivered. When your medicine's ready, you'll get a notification from the app as well, telling you that your order's ready to be collected. The other way to add an e-script, if your doctors, say, printed it off for you for some reason, if they're still living with the dinosaurs, is you can click the add. No, you're not. You can click add e-script token and then it just opens up the camera for you and you can scan that token as well. Once again, it then appears in your app with all of your other e-scripts. So e-scripts are a great way to help manage your prescriptions. If you only take 1 or 2 medicines, getting the tokens sent through to your phone as an SMS or an email is a nice simple way to access them. But if you're taking a few more medicines, it can get a little bit tricky keeping track of them all. So that's where the MedAdvisor app and the active script list can help you keep a track of all of those prescriptions. The other benefit for e-scripts is that they save paper. Your doctor's not printing out scripts We're not printing out repeats when we dispense the prescription either. And like I said before, it's a portable script. You can send it, you can share it. There's so many other benefits to e-scripts over paper prescriptions. And the MedAdvisor app helps you remember your medicines, helps you remember to take them, to order them, and helps you keep track of all of the scripts that you're taking. That's it. Any final questions? Thanks for asking questions along the way. Very good. Well, thanks for...
I haven't finished.
John, sorry, go on.
What happens if it's a fine day and there's no cloud?
Well, then the world shuts down, doesn't it?
Well, that's what I mean. The serious side
Yes.
of that is if something happens in the cloud.
Yes, yeah. So I guess there's a couple of different issues with that. If the pharmacy itself just happens to lose the connection to the internet, many other things break as well. So unfortunately, it will mean we won't be able to access your prescription. The infrastructure that runs the cloud service is decentralized, so it's spread across many different locations and built with redundancy in mind, so that unless something catastrophic happens, there is a workaround.
Is it worldwide or Australia-wide?
So some other countries do have their own implementation of e-scripts, but the way that it's the way that it's implemented in Australia is Australia only. That's right. And the way prescriptions and medicines work, you can't take a prescription written in Australia and get it filled at another country, and a prescription written in another country you can't get filled in Australia. So it's only an Australia system.
The cloud thing is Australia.
Yeah. And the scripts are stored on servers in Australia as well. Yeah, not overseas. Yeah. Alrighty, well, thank you for coming along.
Yep.
If you'd like to provide some feedback, there's a link. And if you have any questions about the MedAdvisor app or e-scripts or active script list, feel free to ask your local community care chemist.